ready to explore the extraordinary world of tech? Welcome to the X-Tech Podcast, where we connect you with the sharpest minds and leading voices in the global tech community. Join us as we cut through the complexity to give you a clear picture of the ideas, innovations, and insight that are shaping our future.
Hello and welcome to the X-Tech Podcast by Fox Agency. I'm your host, Debbie Forster, MBE. I'm the CEO at the Tech Talent Charter and an advocate and campaigner for diversity, inclusion, and innovation in the tech industry. Today, I'm delighted to be joined by Ahmed Abdulla, founder and CEO of Digipharm. Ahmed, thank you so much for joining us today.
Thanks for having me.
So, Ahmed, for our listeners, we love to hear about what you do, but it's also really useful for us to understand how you got here. Some of us get into tech, we're born with a laptop in the hand. Other of us have a more squiggly career to get here. How did you make your way into tech?
So I think it's been quite an interesting journey. Initially, I think when I was around 10 or 11 years old, me and my brother built our first computer together, buying all the parts from a computer fair and then putting it all together. And it was something that was really new at the time and something that was exciting. But then obviously as I carried on with my education and secondary school and things like that, the IT and computer industry was, I'd say, really immature at that time. So, I went into study within the healthcare industry. Thinking, that could be a really great career path. But then as my career advanced, I saw the advancement in technology and I thought it could be a good opportunity to combine the two and really focus on how tech can really help healthcare be better for everyone.
Absolutely. So you were born with that laptop in hand, but it's, I think, like a lot of people on the in our audience would say, it is that realizing that what you play with could also be something that becomes your work. Now, in going into the pharmaceutical and medicine and probably what felt like a safe career, I think I read somewhere that you also would have described yourself as a bit of a rebel.
Yeah, I think I'm just somebody who's wasn't really happy with the status quo and how things were being done when, there are clear opportunities for improvement or change. And I think I've always been like that. Always challenging things, trying to find better way to do things. And, often a lot of established entities or organizations work in very, structured or archaic ways. And I'm somebody who tries to, try and move beyond that where possible.
Fantastic. So you are that rebel with a cause. And that's refreshing as too, because we do know a lot within, the pharmaceutical industry is about this, how do we make more money? Whereas it feels like you set about in the space to fix some problems rather than just to make some money.
Yeah, the background to that is, I trained to be a health economist. And really what the main core of that, let's say, career or vocation is helping healthcare organizations understand what they can and can't afford with their limited budgets. Initially working around high-cost therapies like cancer drugs and things like that, and supporting the NHS understand what they could really pay for their citizens. That's something that I thought was really interesting and really exciting. And this was an area of healthcare that I saw, was really impactful. I decided to really focus on that, continue my career in that area, and then move to Roche in Switzerland and help get some of these high-cost drugs into different markets around the world.
Lovely. And I love that social undercurrent for what you do. Now, if I were to look up Digipharm on the internet, it says that you're focusing on value-based healthcare. Now, for somebody who's not in the field, can you tell me what that means?
Yeah, so working in that health economic space, we often saw that many healthcare organizations couldn't even afford to pay for these, newer, innovative drugs. And it is mainly due to budget restrictions. And some of it was driven by the fact that even when patients did not benefit from these treatments, or these treatments fail, that health systems, whether they were paid for by governmental bodies like we have in the UK, or insurance companies, that money was essentially going down the drain, and it left healthcare organizations in difficulties to continue paying for some of these newer and higher cost therapies. And around that time, in I'd say the late 2017, 2016, there really became a push towards value-based healthcare within the healthcare ecosystem, and that's essentially paying for healthcare or rewarding healthcare activities that work and provide benefits for the patient. Combining that with what I was doing in my day job, it just sounded like this was definitely the right thing to do. But at the same time, there were no, let's say, systems or solutions that were dedicated to help healthcare systems employ this, new business model. And that's where, Digipharm came about.
And that, it sounds so practical, doesn't it? And, what we want to believe would be happening with healthcare is what works is what gets paid. That's a really big problem space. So where did you start setting out your stall as Digipharm? What were you focusing on in that space?
Yeah, we took it back to basics, really, just helping these healthcare organizations, pay for performance, and looking at, some of the requirements to do this. We realized it was a type of business model where it was driven by data rather than, volumes, what we'd seen in the past. And when you're talking about let's say a payment model where all the contracting parties, let's call them, were incentivized to present the data in a certain way, there was an opportunity for a third party to come in there and be that trusted data processor on behalf of all of them. Just taking the example of, for example, a health system, they would, for example, get a discount on the drug or therapy if they say it doesn't work, and if the manufacturer or pharmaceutical company was responsible for that data processing, they'd want to say things do work. So we took the approach of taking that a step further from the technology point of view as well. It wasn't the fact that we're just a independent third party. The technology stack, such as using a blockchain and smart contracting, means that once the parameters for these agreements are set up, we as an organization also step away and let the technology do the work.
So interesting to choose to go and to use blockchain to do that. Was that your first choice?
Yeah, it was. I did consider, different technology stacks, but this, blockchain and smart contracting really made sense. In the healthcare and pharma industry, there's a lot of confidentiality around pricing, especially some of these, higher cost therapies or more innovative drugs. And that was something, the additional security and confidentiality and privacy aspects of blockchains was something that was really exciting. But then the automation piece of smart contracting, we hadn't seen anything like that. And during 2017, when we started, that was when Ethereum really started getting a lot of traction with their smart contracting solutions, and that was, one of the first systems that we deployed on.
So it was one of the first choices. So in having to move perhaps across different platforms, what did you learn? Is there anything that you know now you wish you knew then?
It's a good question.
That was the laugh of pain. that was the laugh of, oh, it hurt at the time, but I've learned to laugh about it now.
I think at the time it was the right choice, but in the case of Digipharm, we've actually actively migrated from different ecosystems and environments to better and more suitable solutions as we've moved along. So we started with Ethereum, and then we moved to a enterprise level blockchain called Corda, which enabled us to add legal pros for these with these smart contracts, as that was some of the feedback that we got from end users, especially pharmaceutical companies. And then more recently, again, we've transferred to something a lot more flexible. And that's just for the contracting piece. And, we also have an adjacent digital currency, which we're going to be using for patient engagement and user rewards for our DigiHealth portals. And with those, again, we've also, conducted already 2 migrations. Again, trying to find the best available solution. And I think we're not shy to do that at all.
And that's important. I think a lot of time and energy can go to try and find the perfect solution, where it sounds like for you, success has been knowing when to change your solution. And I'm hearing you're listening to the customer. What other things tell you it's time to pack the bags, we're moving house?
Yeah, so with the customer, we focus on their experience and the problems it solves for them and their needs. But from the technological aspect, we very much make those decisions ourselves. And if we feel something is the right move, or we feel a certain technology stack is outdated, we'll move, pretty rapidly, to be honest. We don't want to be left behind, just like we've seen, healthcare systems stagnating. In some regions, even in developed countries like the UK, you see that they've been using, some of these legacy systems for 20, 30 years. And, we see the obvious problems, and that's something that we really want to avoid. We don't want to be stuck in that same box as them.
And that's an interesting mindset to adopt. So I like that you're hearing that combination. It is absolutely listening to the customer because they understand the problems, but then you're bringing your expertise of solutions. But there's also a mindset that I think is powerful, and it is that packing light. That rather than get yourself so embedded with something that you are then risking that obsolescence, but to be ready to move and to have the systems, the approaches, the mindsets that allows that migration across is important if you're looking at any emerging technology at the moment, because the best technology, she says with strong inverted commas, the best technology today is tomorrow's dinosaur. And so building in that way of moving across. And so it's interesting that you talked also about the patient side, so the supply you've been working on, and a lot of people do that, but I like that you are looking at both supply and demand, and those aren't necessarily the same tools or the same solution. So talk to me about what you are doing on the customer side, the patient side.
So, we have the B2B contracting side, which helps healthcare organizations pay for these things based on how well they work. But in terms of actually evaluating how well things work, a lot of input is actually required directly from the patient. And if I just give a simple example of, a pain therapy or a migraine drug, only a patient can tell us whether this works or not. So we've developed a patient engagement ecosystem called DigiHealth, where patients can not only, provide feedback about what they are receiving and the quality of service and the experience they've had, but also then expanding upon that and building on our credibility with working with some of these, large healthcare organizations to empower them and enable them to hold their own medical data, benefit financially from this data as well. Which currently is being done behind their backs and, a lot of the time without them knowing. Being able to access, different digital health solutions, things like screening, epigenetic profiling as well, which can tell you how your health is changing over time based on your behavior and exercise and activity. I think that's something that also excites us. If we're going to fix healthcare, and fix it for good, I think, patients really need to be partners in this and not just, end users or end customers.
And there's 2 bits of what you said that I hear more and more often emerging from the wisest in our space. And that is taking our users on a journey and our view of our users on a journey. That moving them from being passive users into actually being partners in the process. And what I like is then you take that the next dimension. They're not just a set of individuals. How can we turn this into an ecosystem? I think in the same way that we've talked about a lot of companies looking and realizing the gold mine they have in their data, there's also within tech. More and more people waking up and realizing what a gold mine they have in their users as an ecosystem, as a resource, as a partner in that piece. Now, in doing that, in going on that journey, is there anything you learned and have learned again through that painful things you wish you'd done sooner, better, differently about working with your users that the audience could learn from?
There's a few things. So in terms of the partnering with communities and growing communities and things like this, I think a lot of the, for example, let's say new founders or organizations of thinking and working in this way, I don't think they appreciate how driven some of these users can be and how they can really act as ambassadors for your ecosystem and your growth. And that's something I'd encourage them to really embrace. I think that's a huge opportunity. And one thing I think I've learned, and that's also been really interesting, is that people are very well informed these days. Once something interests them, they have so many resources available to them, and if they're not well informed, how fast they can be informed again is something that's really impressive. And I think organizations should try and use this to their advantage. It changes ventures from having one or two voices or 3-4 voices within a team to thousands or millions of voices eventually, and I think that can make all the difference.
But it's a mindset difference, isn't it? I remember talking to someone once that said, look, I wanted to have the user voice. I just didn't realize it was going to be so loud and sometimes so grumpy. And it is that really trying to change our mindset of those voices matter and they have opinions and they may have things that we didn't think about. This is not just customer satisfaction, which is kind of keep them quiet, keep them happy but quiet. It's really listening into those voices, because there will be some of those voices who are impatient or angry or have those other ideas. And do we see that as a threat or a nuisance, or do we see that as powerful insights?
No, I completely agree. We've taken the approach of having focus groups with our members, directly engaging with them. I mean, you're never going to be able to satisfy all of their requirements, but if you're able to capture that general need or request from them, I think you can satisfy the vast majority, and I think that's the best we can do, really. Beyond that, I think it's also useful to give them some sort of skin in the game as well. I mean, in terms of our patient ecosystem, we're going to be sharing 50% of the profits generated on our digital health marketplace with them directly. So I think having these additional incentives, and ours is driven by digital currency and this profit sharing as well. I think that those are things that can really accelerate it from being a following to a really strong community.
Love it. Okay, so I'm sitting in the audience, even if I'm not going into healthcare, I am thinking about, when I'm looking at solutions, am I packing light? Am I ready to move when it makes sense, both for our users and for us? I'm hearing a completely different mindset to how we see our customers, and creating that voice and actually going the next step. I mean, I don't think there's a lot of organizations out there that would say they're giving their users or their customers skin in the game. So that's motivating and driving things, which is a completely different thing. Really, really useful. Okay, well, let's step back then, and let's look at the horizon. I like to hear from my guests to understand, when you look at the horizon, what are you seeing? So let's start on the negative side of the glass half empty. When you are looking at the horizon, what's worrying you?
So in terms of what's worrying me, I think there's the main thing is obviously, I think, affordability and all this, these economic issues. For us, though, we've turned that into an opportunity. I think that's essentially what Digipharm was built for, to be able to, help healthcare improve even in the hard times. I think that's something that our system can do that's relatively unique. While that worries me personally, obviously, from a selfish point of view as a business owner, I think that's something that is more of an opportunity. But it does, generally for the wider public, I see a lot of inequalities. Back to that, rebel mindset. I don't agree with a lot of things that people in charge are doing. So that's one of my one of the things that I see as a big issue globally. And then in terms of things that excite me and things that could be massive opportunities, I see advancement AI is really scary, but again, that's a massive opportunity again for those who embrace it and really take the time to learn and study it and see how it can help them in their daily life or in their work. Another aspect that I'm really actually excited about, the advancement within the digital currency space as well. We see more and more countries and regions adopting these things, and I think that again puts our DigiHealth ecosystem in good standing.
Fantastic. And I like the way you talked about that, bringing that rebel insight, that rebel way of thinking into what we do and how we do that. It's important that we take that wider mindset and bring it into our world and into our work in terms of what we do that. Is there anything at the moment that you would say, Ahmed, is there an event, a podcast, a book, some research? Is there anything that's inspiring you?
I think there's a lot of things that inspire me. I wouldn't say they're linked to any specific podcasts or events or anything like this. To be honest, I think one of my biggest drivers recently has just been exercising and the energy I've been getting out of that. I mean, 4 or 5 months ago, I started exercising every day, and I didn't do that before. And, the drive that's given me has been amazing. And that's, if anyone's listening, I'd recommend everybody to do that, because it's, you can read all the books in the world and things like this, but you need to get active, get going. And, I think it can change lives.
It helps us in so many ways, but I think that getting away from the screen, getting away from that thinking, going out and that physical activity. There's so much research coming out lately in terms of how our brains work that show that's where the real processing, that's where the real thinking comes, and that change of scenario. And then if you add into it the physical being, it's sort of a win-win cycle, isn't it?
Yeah, I think we especially us as, let's say, tech founders, we need to get that perspective. It's not about this 15-inch screen that we have in front of us all the time. We also need to understand and embrace that there's a real world out there, and the solutions we develop should go to impacting that side of our lives as well.
And those great aha moments rarely happen when we're sitting staring at that screen. They're actually when we're completely away from the screen and pulling that together.
That's when we...
Useful advice. It's raining outside for me right now, but you're inspiring me after this to go for a walk. So listen, I really, really enjoyed talking to you. I appreciate you making the time to come to share with us your thoughts. All the best with Digipharm. I'm really excited about what you're pioneering here.
No, thanks a lot for the invite. Really grateful for the opportunity to talk to you guys, and happy to come back in a couple of years, hopefully, when we've changed, a lot of, or improved a lot of lives via our solutions.
Fantastic. Okay, so we'd love to receive your comments and thoughts on what you've heard, and you can share them with us at fox.agency/xtech. Thank you for listening. If you're a tech innovator and would like to appear as a guest on the show, email us now at xtech@fox.agency. And finally, thank you to the team of experts at Fox Agency who make this podcast happen. I'm Debbie Forster, and you've been listening to the X-Tech Podcast.
Keep exploring the world of tech. Subscribe to our podcast and never miss an episode. To discover more opportunities for global B2B tech brands, visit fox.agency today.